And good afternoon to you. This is KBZE General Manager Howard Castay. And with me on the phone right now, we've got a very special guest. And this is Mr. James Ducote, who is the Deputy Director of Navigators for a Healthy Louisiana. How you doing today, James?
I'm doing good, Howard. How are you today?
Good. Now, why we're talking to James, folks, is this. As you know, we've been running commercials to get people to re-sign up for the health insurance through Medicaid. So James is going to explain to us a little bit about that program, as well as some other programs that he works with throughout the state. So James, take it away.
Absolutely. Thanks for having us on today, Howard, with this important message that we're trying to reach all the residents of Louisiana to help keep them connected to their health insurance options. Navigators for a Healthy Louisiana is a free, federally funded, nonprofit statewide program. We're supported with a grant from the U.S. Department of Health and Human Services, Centers for Medicaid and Medicaid Services. We're actually written into the Affordable Care Act to assist Louisiana residents with access to low to no-cost health insurance options depending on their eligibility. One of the ways that we're connecting is through the Medicaid unwind and helping mitigate some of the impact on families and children. As everyone knows, in late April, after the pandemic and the public health emergency ended, Louisiana State Medicaid began a 12-month redetermination period where they're determining eligibility for all current Louisiana Medicaid recipients. And as of November, they've initiated almost 1 million of those renewals. So just give a little recap of that. To date, we've had over 300,000 Medicaid accounts that have been terminated since 2020. And our work with Navigators out across the state of Louisiana is to help connect those people who have lost their coverage or deemed ineligible to actually find that coverage and reconnect.
Okay, and so tell us, how does someone renew their Medicaid or their Medicare?
You know, they can connect to, obviously they can connect to the Medicaid office itself. With the influx of calls and assistance that's needed right now, we have navigators for every parish across the state that can actually sit one-on-one with those consumers and help them go through that process, whether it's being on the phone with them and help answer those tough questions, go through that application process with them to make sure that it's a seamless transition. And, you know, we're there to help the Louisiana residents really navigate that confusing area that we call health insurance across the state.
You know, one of the biggest things that I hear from people is that I have insurance, can I get Medicaid? Or I don't have insurance, can I get Medicaid? How does one's personal health insurance play into this?
Well, it's all based on individual circumstances. We always tell everyone no one's circumstances is identical to any others. And when it comes down to it, it's based on your life circumstances and your income level. And there are options available for all consumers out there. You know, if they make a certain amount or they have a certain amount of people in their household as dependents. And it's really going through that process, the application process, and determining the eligibility and what's out there and what's available for that individual. So we always like to make sure that everyone's available, and understands that just because you may not have qualified for something last year if you tried, it's always a good option to check again, because you and I both know that the laws change so often, and we have mitigating circumstances that may qualify someone now that they may not have been qualified or eligible for last year.
And then what about people that are disgruntled with their current program? Because I talked to someone the other day, and they were telling me that they feel like they weren't getting what they thought they were going to be able to get by enrolling with the Medicaid program. Right.
Well, we're able to work with those individuals one-on-one and really get to the root cause. And a lot of times it's the wait times on the phone. It's not being able to connect to someone. So that's why we find it unique that our navigators can actually sit with those people one-on-one in person, meet those people where they are, or speak to them over the phone or a virtual conversation or meeting, via Zoom or what have you. And we work through those, what we call complex cases with those individuals, to really make sure that they're not discouraged from this process of getting health coverage and taking care of their essential health needs, just because of some of those things like that.
Okay, folks, I hope you're listening right now, because the long and short of it is this: your health is your wealth. It doesn't matter how much money you're making. If you get sick, you need to make sure that you're covered, and that's part of what the wonderful folks that James is with, the Navigators for Healhty, Louisiana, what they are up to. So tell us, how can Louisiana residents connect to your Navigators for services?
Right now, we're in what we call Marketplace Open Enrollment. It's currently going on through January 16th. And anyone who may have been redetermined and ineligible for Medicaid and would like to explore other options as well as getting help with their Medicaid process could always call us at 1-800-435-2432 or visit our website at getcoveredla.org and fill out a short form, and we'd have a navigator reach out to you within 24 to 48 hours.
Okay, all right. Did you hear that? All my Teche Action Clinic patients that might be listening, you can call 1-800-435-2432 or go to their website at www.getcoveredla.org and fill out an online form. Now, let me ask you this question. What options are available for Louisiana residents who may no longer qualify for Medicaid?
So those who are no longer eligible for Medicaid, they have options to apply for through the federal marketplace, and we assist with those applications as well. Normally, under normal circumstances, we may have what we call an unwind special enrollment period for those individuals. And also, like I mentioned before, we are actually in Marketplace Open Enrollment, so it's the perfect time for anyone who may need assistance to contact us before January 16th so that we can schedule that one-on-one assistance and help you find the coverage that you need. Our goal is to have 100% of Louisiana residents provided with health insurance coverage options, either through their employer-offered coverage, through Medicaid, or through a health insurance marketplace plan.
Okay, and so when you're out, of course we want everyone to sign up during the open enrollment, but what about afterward? Are you all still available to help out people during the year?
Absolutely. We're available 365 days out of the year. We're there to help determine eligibility through what we call special enrollment periods outside of open enrollment. Anyone who's had any type of life-changing circumstances, if they've lost a job, gotten married, had a child, any of those things could affect their eligibility. And like I mentioned before, just because your circumstances before may have kept you from getting coverage, it's always a good idea to contact us and reach out so that we can go through that determination process with you again to determine if you are eligible, because there are options available for everyone.
Okay, and can we talk a little bit about children's health insurance and
Sure.
children's health insurance requirements? How does all of that come into play with Medicaid as well as Medicare? Well, probably not Medicare, but Medicaid, right?
Right. With Medicaid, the Louisiana program is called LaCHIP, for Louisiana Children's Health Insurance Program. And all children, families and children, like we said before, should have access to this. Right now, we're through this unwind period. We're finding that I believe it's close to 100,000 children have lost their coverage due to not returning completed packets for renewal that may have been sent out from Louisiana Medicaid, or just falling through the cracks. We want to make sure that we can help those people, but because there are options, children or predetermined to go through that LaCHIP process through Louisiana Medicaid. So we're there to help those children as well.
And again, give us your number and your website, please.
Our phone number to reach us is 1-800-435-2432, and our website is www.getcoveredla.org.
Okay, now let's talk a little bit about, particularly in our area, we have a lot of Latinos who have moved into our area. Do you all offer help in Spanish?
Absolutely. In our Homa office, we actually just opened an office in Homa, and across the state. We have help available for every parish without any obligation or charge, and we also do offer language interpretation services that are available to anyone who may need that in over 200 languages. So we're able to assist anyone at any time.
So if someone would call us 1-800-435-2432, would they hear an option for Spanish, or is there a separate number?
They would not hear an option for Spanish, but we would connect them to the service that provides that interpretation services for us.
And can you give us that number right now?
It would be the same phone number, the 1-800-435-2432, and we do have services in place to help connect those people who may speak a different language, connect to an interpreter.
Okay, so once again, when is the deadline to re-sign up for your Medicaid program?
So at any time, Louisiana residents can contact us for help with Medicaid. The only deadline we have currently right now is open enrollment for a federal marketplace plan, which is January 16th. But they can contact. There is no deadline right now. The Medicaid unwind is ongoing until, I believe, July. I may be off a month or so, but this process was a 14-month-long process to renew all Medicaid recipients in Louisiana.
All right. That is incredible, wonderful information. And we hope we can call on you again, James, to help unscramble stuff that looks a lot very complicated.
Absolutely. Anytime. We're here to help educate Louisiana residents, and our goal is to make sure that 100% of Louisiana residents have access to the health insurance coverage that they need.
All right. Thank you so much. And there you have it, folks. Let's get that number one more time. Give that number one more time to call to sign up for Medicaid, please.
Absolutely. 1-800-435-2432, and we'll connect you to a navigator in your area.
All right. Thank you very much.
Thank you.